I am going to go ahead and get started. I realize people will be coming in, but in the interest of keeping on schedule and using our time as productively as possible, it's great to see you all again. If you don't remember, I'm Cynthia Salter. I'm the interim director of the Center for Global Health at the Graduate School of Public Health. And as I said, it's great to see all of you coming back. Our kickoff last week was certainly a wonderful opportunity. I was grateful I got a chance to meet a number of you in person during and after that event. So really excited to be moving forward. So today, welcome to our first working session. We're excited to have expertise from two very important areas in addition to the speakers today, in addition to their expertise in public health, also have experience in library science and researching information and materials and the law. So we're happy to welcome our two speakers today. We will be hearing from Helena Vondell, who is the research and instruction librarian at the Graduate School of Public Health. And you have her biography that tells you a little bit about her. She had a degree in library science from Rutgers University, an MPH as well in management policy and community health. She came to us from the University of Texas School of Public Health. She's a pleasure to work with. I enjoy working with her a great deal. And you'll have an opportunity to hear from her about the reference source that she's prepared for you. And then in the second part of today's session, we'll be hearing from Elizabeth Van Nostrand, who comes to us as a JD with experience, not just in public health, but also in law and health policy. She sadly has departed from the University of Pittsburgh, but we feel very fortunate to have you back again for these sorts of activities, Dr. Van Nostrand, and she's currently at Temple University. Previously, she was an associate professor in our Department of Health Policy and Management, but as I said, she has since moved to the school, to Temple University. And so we'll be hearing from her in the second half, and we can tell you a little bit about her background as well. And she also worked a great deal with us last year in terms of the coaching for the winning team when we went on to the next competition. So I'll turn it over right now to Helena, who will be starting with her part of the presentation.
Great, thank you. So I'm going to send out a link to everybody real quickly in chat. And this will take you to my LibGuide for this competition. That's what I'm going to focus on today. So let me share my screen. So I've put together this LibGuide for this particular competition, and I'm going to just work my way through it and kind of talk about how our resources work here at Pitt for those of you that maybe haven't done as much literature searching. So we're trying to avoid Google simply because we want to make sure that you're working efficiently. You know, that's kind of my goal, is I want to just let you work efficiently. I'm going to point you to some really good resources and get you moving quickly. So the first page is just a welcome page, and I'm going to add additional names and information for contact information if you need some assistance. But let's go ahead. On the left-hand side, I'm going to pull up our overviews, which focus on a lot of our intergovernmental agencies like World Health Organization, which PAHO is part of WHO, Pan American Health Organization, and they have a whole section on Guyana. And then coming out of WHO again, they have something called their Global Health Observatory, which is a huge statistical database. So it's covering statistics, international statistics, very, very, very extensive. And they've got lots of great graphics. So if building in some of those graphical presentations, even for yourselves, as you're thinking about how you're going to present your information, having some of those graphics for some people, it's easier to understand than just looking at a bunch of numbers, right? And then there's a whole series of reports that will talk about trends as well as regions. So it may not focus specifically on Guyana, but it could talk about like the Caribbean, which Guyana is considered part of, as well as, South America, right? And so, it'll talk about different trends that we see around the world. Lots of economic data, and you can see I've pointed you right to the reports from the World Bank with that links to data about Guyana specifically. And then the IMF, International Monetary Fund. So we've got the World Bank on the one hand and the International Monetary Fund. And I'll be honest, as I was looking at these different resources, I actually thought to myself, well, what's the difference? Why would I want to do both? And then I found a wonderful little description about what the difference is. and I had to put it on here, just because that was just one of those things I thought, I really needed to know. For me to move on. So we see that the World Bank is working with developing countries to reduce poverty and increase shared prosperity, while the IMF serves to stabilize the international monetary system and then acts as a monitor of the world's currencies. Now they're still looking at individual countries, but they have between World Bank and IMF, they have very different missions. And then we have the Inter-American Development Bank, which has its own mission statement. So it's got a country profile and then a country strategy. And they offer a whole series of specialized data sets. So again, we're getting into the numbers side of it, not just a report that provides an analysis of the numbers, but we can also retrieve those numbers ourselves. And our indicators data, they don't talk about health or access to health care. And I went through and I looked at all of these pretty thoroughly. But you can look at some of the social topics such as demographics, education, and education is a pretty big predictor of health trends and health outcomes. It is an important determinant of health. Some people would actually have argued that education is one of the biggest determinants of health, public management, things like that. So, and then I found a lot of resources that look at the indigenous and ethnic minority populations. One of the reasons I wanted to find those kinds of studies is because we're talking about, have they been given the case yet? Yeah, they've got the whole case. Oh, that's okay. I just want to I'm like out of that. I was out of that loop somehow. But anyways, when we talk about the remote areas in Guyana, we're really talking a lot about the indigenous and ethnic minority populations and how they're affected and how they're impacted by politics, by policies, and by when we look at what's happening with mining and specifically gold mining and deforestation, things like that. So we want to be real cognizant of the different groups that are impacted and also some of the reasons why, how they fit into this total picture. So I found lots of several resources that cover that. Okay. And I'd like to let people know if you've got a question about anything I show you to please stop me. Okay. Or let me know or put it in chat, something, because there's nothing worse than having a question and you're like thinking about this and then you never have a chance to ask the question and you feel like you've missed part of the presentation because you were worried about your question. So I didn't click on any of these because I'm saving that on my search for articles and my books and stuff. But so let me go ahead and quickly take a look at click on the search for articles. So the first tool that I want to show you is it's called, we call it a discovery tool. And I'm sorry, it's like a kind of a library land term, but we've got this great research tool that you can go in and search, and it's sort of like one-stop shopping. So I went ahead and I set up searches that all you've got to do is click on one of the searches. And let me do my Guyana remote and poverty with disparities, which finds, and I've even told you about how many articles it finds. That'll, figure this is going to be plus or minus. But if I click on this, it will automatically go to our discovery tool. And then if I'm at home, I would want to sign into it just because it makes it, you have to sign in. If you want to look at an article, you'll have to sign in at some point. But you can see my search up here. I looked for Guyana or Guyanese, and I said either in the title or in the subject. And then I wanted in any field, the hinterland, which is what it's called, or remote or rural. And then I also said, give me disparities or health or inequalities or politics. I threw politics into this one, or poverty also. And I've limited it from 2010 to 2022. Now, what's nice about you being able to see these is you could go in and say, well, we didn't include, in this, maybe you want to put indigenous in here too. So you could go ahead and add, any term you wanted to up there and then redo the search. I have a couple of filters that I've turned on. So it's only looking for articles and only those articles that are available online. Okay. Now, is it 100% perfect? There's always issues when you're doing searches. So, the first one, I'm kind of like, I might want to come back to that one. But the second article, digging for care-seeking behavior among gold miners in the Guyana hinterland. Well, and so they're looking at motivations for, will they get tested for malaria and treated, or won't they? So that's sort of what this, article is focusing on. I can see it was published in 2020. And if I actually wanted to see the article, it says it's available online. And so I can just click my way on through and get a hold of the article. Where is it sending me? There we go. I don't know why it's, there. It's sending me, it was 3 clicks to get there. So I've got my entire article right here. So it's a pretty easy process. Let me go back to this page. Now, we have our system set up, and I went back to my original discovery page, and we have all of our links set up so that they automatically go to the resource. Sometimes what I like to do is I'll do a right click so that I can either open the link in a new tab or a new window, just so I'm not going back. And so I have the chance to go ahead and keep looking at all the resources, right? So I did that right click and said, open the link in the new tab, and then it puts it up here. And now I have my deforestation search. And here we go, jaguar attack. But here's an interesting, the Guyana Shield Rainforests Overlooked Guardians of South American Climate. So more. So again, they're not always all perfect, but we are looking at these in relevance order. So we're sorting by relevance. And honestly, if you were doing a search in Google, you're going to have 5.5 million items, and you're going to look at the first page, right? Well, here you've only got 785, and I think you'll find that you'll have a good number of articles right up front for each one of these topics. I'm sorry, I'm reading the article titles, and I'm thinking, oh, that looks really interesting. Temperature rising would slow down. So carbon emissions from tropical forest degradation, gold rush in a forested El Dorado. So that's a great article, because that's one of those real critical issues when you look at gold mining and what's happening in the Amazon. So, okay. And see what's so nice is, since I opened it in a new tab, I just go back to my tab that says search for articles on it. Any questions about this one? I've tried to put in different topics, such as you'll see it's maternal and infant mortality, alcoholism, suicide, family violence, Guyana and crime, accidents, including workplace injuries. So I've got a couple of topics. If anybody wants me to post a topic on this page, please feel free to let me know, and I'll go ahead and I'll do the searches and, put something together and add it to this page. Okay, so let's talk about Pubmed, which here in the health sciences, for those of you that aren't in health sciences specifically, we're real big on Pubmed just because it is the world's largest biomedical research database. It's a critical tool that gets used all over. And so I went ahead and did the same thing where I created searches for different topics. And I even did one on emergency services, which found 2,400. I probably need to play with that search a little bit, but I've got, here's Guyana and access to health or healthcare. So I'm before I click on it, one of the things that I want to point out is that information is not free. We live in a world where it costs a lot for good information. And so our research articles can be very expensive. If you go to pubmed.gov and do a search and try to get an article, you might hit a paywall. They want you to pay $49.99 and you get to have the article for 3 days or something ridiculous. We have already paid for the journals, okay? Pitt Library pays millions of dollars every year so that you can access for free these journals. But if you go to pubmed.gov, they don't know you're part of Pitt. We have to have a way to let them know. So I've given you a couple of ways. One of them is we've got a link to PubMed and that always tells PubMed that you belong to Pitt. But the problem with that is then you can't use my searches. Another technique is to create a My Ncbi account. It's absolutely free. It's not difficult, and you can customize it so that you identify yourself as being part of Pitt. You can set up your account so that you authenticate through Pitt, and then you can customize it so you always see the button, this links at Pitt-UPMC button that will get you to the journal articles. So I'm going to show you an example using the My Ncbi account, okay? And let's take a look at Guyana, and I'm going to do access to health or healthcare. There we go. So, wow, that was fast. You know what I want to do? I'm sorry. I always forget. I'm going to do my right click and open this link in a new tab. Okay. I'm going to do my right click and open this link in a new tab. What happened? Oh, there it is. Okay. So here's my search. And again, I've done the 2010 to 2022. And if I click on, I'll just do the first one. It's Diabetes and Foot Care Project. I'm going to click on this article. There's nothing over here. This is actually a free article, of course, but there's nothing over here that also says links at Pitt-UPMC. And that's what I need to see. So in the upper right-hand corner, I can sign in to Ncbi. And I'm going to do my Ncbi login. And so I can just go ahead and sign in. So it knows who I am. And for the rest of my articles, let me go back. Of course, today it's being weird. Let me find an article that's not PLOS. Ah, there we go. Rise of cardiovascular diseases. Oh, I'm sorry. Oh goodness, I forgot. I did PubMed. These are all PubMed Centrals. These are all going to be free regardless. That's why it looked so weird to me. PubMed Central articles are free. Yep, the canned PubMed Central articles. I am so sorry. Golly. Let's talk PubMed. So I have my canned PubMed searches. That's what I was going to try and show you. I have two different, there's a PubMed and there's a PubMed Central. PubMed Central's full text of articles, and PubMed is a little different. And so I want to go into PubMed, not PubMed Central. Let me find my PubMed on here. Okay, there's PubMed. And this, I did set it up so that you can just copy and paste the searches, but you still want to make sure that you log in. And so it shows that I am logged in. That's why I wasn't, my golly, silly me. Okay. This is sleep behavior. This is what I wanted to make sure you all saw. And I know I need to get off in just a second here. So it says links at pit-upmc. And when I click on that, it ensures, rather than clicking on Wiley in this case, it is a full text article. But if it's not full text, you would hit a paywall if you click on the publisher's link. So I did set this up so that if you highlight, copy, and paste, then you can go into PubMed and run those searches. But again, creating that My Ncbi account lets you go directly to PubMed instead of coming in through the library. Oh, this is kind of an interesting one. Global burden of disease. Okay, I do like public health. A few more resources, and then I will go ahead and see the camera to Elizabeth. I do have books and book chapters in here. So I actually went through and selected those specifically. I did a bunch of searches and added, so threats to mangrove forests, citizenship, democracies, and media engagement in emerging economies and marginalized communities. So it does have a section covering South America on here, land rights, biodiversity, the Caribbean, hegemony in Guyana. So there's healthcare systems. So it covers a multitude of countries and then healthcare systems around the world, special reports. So you can see I was really trying to target very, very specifically your needs for this competition. And then I've got I've got various climate change reports. So you can see climate change, there's reports, climate change and health, Guyana and regional climate change reports. So things that have been developed specifically for that region of the country. And then I have a couple of, I have a section that's covering effects of gold mining on environment and health. And I'll be honest, I'm not Google. If you stumble on something and you think, oh, this would be a good resource for the LibGuide, send it to me, and I'll take a look at it and probably just go ahead and put it up there, and I'll thank you. So, okay, does anybody? I'm going to stop sharing now. Does anybody have any questions for me or comments or suggestions? So I'm not hearing my office hours. Honestly, my office hours are so weird. But I have a really bad tendency of waking up at 3 a.m. So if you send me an email and you send it the night before, you might get a response from me about 4 a.m. Because I do that. I sent out 2 emails yesterday morning at 3:30. So send me an email. Really, that's probably the best thing to do. And my email is Helena Vondell, and it's on my LibGuide. I am trying to be as flexible as possible because I know we have students that work. You're taking classes and you work. So if you need a non-traditional office hour, let me know. And not by non-traditional, I mean after 5 or maybe even over the weekend. Let me know if you just can't make, the 8:30 to 5 kind of a schedule. Because I was a working college student, and there were just times when I would say, can't do it. I'm working, I'm in class. So does that answer your question, Ngozi? Okay. Okay. Anybody else? Okay. Well, thank you very much.
Thank you so much for that. Thank you very much. I see we had some questions in the chat, some got answered. But yes, don't hesitate to reach out with an email to our very, very wonderful librarian if you have questions. I know that was a lot of information. I would say don't be concerned if you don't completely understand it. But I do encourage you to take a look at all these resources and begin clicking through some of them. Trial and error sometimes is what we need to do to, to find the things we want, but also if you get stuck or have additional questions, don't hesitate to reach out. So thank you very much, Helena. That was wonderful, wonderful information for us to have. At this point, I would like to bring in Dr. Van Nostrand, who will talk with us a little bit about preparing your presentations. This was a sort of a learn as we go for us. We had her part of the series later in the series last year, and students asked us to move it up a little bit sooner so that you can hear from her what to be thinking about in terms of developing your strategy. From the previous presentation, you certainly learned about where to get your information and wonderful sources for information. And now Dr. Van Nostrand will talk a little bit with you about how to begin developing a strategy, and then just as importantly, how to present it, put it together and present it at the end for the judges. So with that, I'll turn it over to you, Dr. Van Nostrand.
Thank you. Do I have screen sharing capability?
Oh, if you don't, we can get it for you.
I believe you do. I do.
Yeah, try it and
I
see.
do. Let's see.
Okay.
Let me try again. Okay. There we go.
There we go.
I'm not teaching this semester, and I've forgotten everything I ever learned about Zoom. Okay, well, I am thrilled to be here with you all today, and thank you for inviting me. Again, I'm Elizabeth Van Ostern. I was with Pitt for 15 years before moving to Temple in July of 2021. While I was at Pitt, I taught public health law and ethics at Pitt Public Health in the law school. I taught health law, which is the business of healthcare, at the Katz Business School. I also taught professional development, law and public health practice, and a few other classes. But as Dr. Salter said, I am educated by education and by experience. I'm a lawyer. And so what does a lawyer do? A lawyer persuades people. They persuade people to make a deal. They persuade people to vote for their client. And the persuasion comes both in terms of oral communication and written communication. So before I came to Pitt, I had never engaged in a case competition, but over the past 15 years, I think I learned some tips that helped students in the past, and I'm delighted to share them with you. The tips that I'm going to tell you aren't necessarily for this competition, but they're just kind of tips in general for any case competition. And if you want to interrupt me at any time, please do. Just either raise your hand or put something in the chat. I don't think I can see it, but Dr. Salter could, if you don't mind, monitoring the chat and just interrupting me whenever. So I've been fortunate enough to coach students in 3 different case competitions, and they are very varied. And I am thrilled to say that my students had great success in these competitions. They competed at the Cleveland Clinic in Cleveland, Ohio. They competed at Penn State in their inaugural competition, and they also competed last year virtually at Emory. So each one of these competitions had a different focus, and they each engaged different students, but I noticed some commonalities that help teams to advance, and those are what I'm going to share with you today. The first one is prepare, 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 prepare. Anything you can do ahead of time is terrific. And I just learned that you all have already gotten your case. So either before you got your case or as soon as you can after you got your case, here are some things that you could be thinking of. The first thing is obviously to assemble your team. And have the teams already been assembled, Dr. Salter? Okay. As just by way of practice, it's a great idea to have a very diverse team. What do I mean by a diverse team? Well, I mean diverse in terms of your major, where you are in school, your level of experience, your gender, your race, your ethnicity. The more perspectives you can get on your problem, the better. So a diverse group is always tremendously beneficial. So once you have your team, it's a good idea to do kind of a deep dive into what your strengths are. So in that way, you can identify roles and responsibilities moving forward. So who's good with numbers? They might gravitate toward pulling a budget together. Who is a good graphics person? They might be the one to make a uniform presentation for your group that's very aesthetically pleasing. And we'll get to some tips on that in a few slides. Who's good with data? Who's good at doing research? Who's good at program management or project management? So it's a good idea to have somebody who's kind of a gatekeeper, somebody who keeps people on tasks to make sure that every member of the team is doing what they're supposed to be doing when they're supposed to be doing it. And finally, it's not a bad idea to identify a leader. What a leader can do is inspire people, keep tabs on people, and they can also, if there's any kind of conflict, they can help to resolve the conflict. Like if there's a disagreement, for example, on which PowerPoint to use, a leader can help to facilitate resolution of that issue. So speaking of data, when I said who's good at research and data, yeah, Ms. Vondell did a terrific job showing you some data sources. So I'm not going to go over any of that. But one thing you're going to want to think about is where are you going to find out how much things cost in that country, in Guyana? And how are you going to value someone's time? What sort of wages do people make? So these are the kinds of questions you're going to want to think about and identify sources so you can substantiate your claim of how much your project is going to cost. It's a great idea to create a template for your slides right up front and to be thinking about and become familiar and comfortable with how you're going to present your data. As Ms. Vondell said, you're not going to want a whole bunch of words. You're going to need to think of different ways to describe your data. So is it a table? Is it a chart? Is it some sort of, what am I trying to say? Just some sort of, is it a pie chart? Is it a bar chart? There are all different ways of conveying the same information. So become familiar with the tools that are available to create those visualizations, because people are going to be looking at what is on your screen and listening to what you say. And the easier it is to understand what's on your screen, the better. Okay, so here are some tips when you are preparing your PowerPoint. You want your audience to be listening to what you say and looking at you and not staring at your PowerPoint. You also want something that is very easy and clear to read. So you can see on the slide that I have 3 different ideas that I'm trying to convey. And I used 2 fonts that were 25 and 1 font that is only 16. And you can see how much more difficult it is to read what's under the 3rd bulleted item than the first 2. So be sure your font is large enough for the audience to see easily. Use attractive colors. Make sure your colors coordinate. You don't want a background that is like on this screen, we have a green and blue background, and the black text makes it very easy to read it. It would be very disturbing, I think, if I had used like a red text or an orange text. It would be much, much too busy. You want to make sure that somebody looks over the entire presentation so it's all consistent. Even if different people do different slides, you want to make sure that one person takes a look at it to make sure it flows well, that the graphics are complementary, etc. Less is more. Use your white space. Also, it is very important at the end of your presentation to have an appendix. I don't know if you all know what an appendix is, but it's basically where you keep all the information with respect to how you got to your conclusions. So, for example, if you have some monetary calculation and you're going to say that, I'm just making this up, but let's say you have some information concerning numbers of beds in a hospital, and you've done your research and you say the average number of hospital beds in this region is 135 per hospital. Each one of those beds cost $2,000. If we outfit a new hospital with 135 beds, it will cost X amount of dollars. If you get a question on how did you get to that number, you can go to your appendix, and it's very detailed, showing the people, showing your judges how you got that number. So you might have all the hospitals, for example, in the region, you divided it by that number and you got the average number of beds. Then you went to this other resource to find out how much each bed costs, and that's how you came to your conclusion. So your appendix is the nitty gritty. It's all the detailed information that you don't want to litter on your initial PowerPoint, but you want to be able to refer to quickly if you get a question about how did you calculate something. So during your presentation, what do you do? So Dr. Salter, are the presentations going to be in person or are they virtual?
Yes, the goal is that they will be in person.
Okay, so that is the modality that I am the most familiar with. Of course, we had to pivot to being in little boxes like this last year for the competition. And those tips are a little bit different because, for example, you can't tell from looking at here that I'm 5'9", right? You can't tell what I'm wearing below my waist or really below my neck hardly. So the considerations are a little bit different. The first thing you want to do is introduce your team. When I took the team to the Cleveland Clinic a few years ago, and that was a wonderful experience for the students from all of the submissions from all over the country. They only invited 16 teams to actually go to Cleveland, and Pitt had a team go. We decided, and I had input in this too, not to introduce the team. Well, the judges dinged the team for that. So it's very important to introduce the team. Whether you want to have one person do the introductions for the entire team, or if you want to each introduce yourselves, that's up to you. But be sure you introduce your team. If this was not a competition at Pitt, I would tell you, be sure you don't do anything to reveal where you're from. If you reveal what your school is, where you're from, or anything along those lines, you will be disqualified and not be able to compete. So that doesn't really pertain to this competition, but in case you do a future competition, please keep that in mind. One of the most important things is to be yourself. I am a big introvert, and the very first time I was at Pitt that I was asked to do a presentation, I tried to do it exactly like my boss did it because she was a great presenter. On a scale of 1 to 10, 10 being really great, I was maybe a 0.5. I was nervous. I froze up. I was not myself. And I learned from that experience that any time that I'm presenting, I present like Elizabeth Van Ostern, not like someone else. What does that mean? That means I smile a lot because I'm a smiley person. You can be very professional and well organized and still smile. Look at the judges in the eye. Look at each of the judges in the eye at different times. It's okay to use gestures as long as you don't overuse them. You don't want to appear to be fidgety. But just like you can make your voice louder or softer for effect, a gesture every now and again is an okay thing too. If you're not gesturing, or if you're not speaking, it's best to probably fold your hands. You can't fold your hands like that in front of you in a relaxed way. Also, be sure you don't engage in any nervous habits like playing with your hair. Sometimes people have a tendency to go like this. Try not to do any nervous habits. It's natural, though, to become nervous. And what should you do if you start feeling anxious? Well, one thing you can do is to breathe. Take a second and take a nice breath in and out. Remember, your judges don't know what you were going to say. So if you forget something, they don't know. So if you do forget something, try not to memorize. If you were here next to me, you would see that I have bulleted notes on what I'm going to say on each slide, but I don't have it memorized. If you memorize it, it sounds very stilted. And if you deviate from the script, you're going to panic. So practice, and know what you're going to say. But again, if you screw up and forget to say something, just move ahead. Dress for success. Dr. Salter, will the students be wearing business attire during their presentations?
Yes, if we're able to do them in person, that's the plan. Yes.
Okay.
So business casual.
Business casual. Yeah. We went to one competition, and at dinner time, the dress was business smart. And I had to Google that because I had never heard of dressing business smart. But that's just me. So you might want to coordinate with your team what you're going to wear, because you don't want to wear something that's going to clash. I do not recommend this, but the winning team at the Cleveland Clinic competition, the time we went, had identical outfits. They all had the same blazer. It was a panel of women, all had the same blazer, the same blouse, the same skirt, and even the same shoes. Now that's kind of one extreme, but you want to make sure that you don't want to detract from your presentation. You don't want the judges to be looking at your clothes. If you were in a virtual setting, I would tell you not to sit like I am. Meaning, you wouldn't want the judges to be looking at the portrait in back of me on one hand of the television beside me, and there's a piano back there, and be looking at what's in the background. You want them to be focused on you, not your clothing, not your background, but on you and your words, what you are saying. And finally, winning. So you get this very complicated problem, many pages, most likely, of information. So the first thing you do is read it and read it and read it and read it again until it finally dawns on you, from all that information you're given, what are they really getting at? What does the creator of the prompt want you to be looking at? Once you figure that out, then you can figure out what your solution is going to be. I urge you to limit your solution to a single idea. Because if you muddy the waters, so to speak, and the judges can't really understand what you're getting at, they're not going to score you very high. Limit it to a single idea. You can have a lot of different ways to get to that idea, to implement it, to move it forward. You might have an educational piece. You might have a community outreach piece. You might have a marketing strategy piece. Those are how you get to it, but have one single solution to the problem, and make sure that solution is both creative / innovative and realistic. So it's not just modifying something a wee bit. That's not innovative, right? It is something that is novel, something that's exciting, but that is you're really able to do it, because it could be the best idea in the world, but if it's too expensive, or it's the best idea in the world, but you don't have the resources, it's not going to fly. So make sure that it's creative and realistic. Create a budget. If that's within, and again, I'm not exactly sure what your prompt is, but if it lends itself to any sort of financial or economic analysis, create a budget. It can be a very simple line item budget. And then again, in your appendix, you can explain exactly how you came up with all of those numbers. You might want to create some sort of timeline for the implementation of your project, whether it's quarterly, yearly, or multi-yearly. The steps that you need to take to effectuate your goal, when is that going to occur? The more specific that you can be, the better. So if you could break it up into quarters, in year one, quarter one, we're going to come up with a marketing plan. In year one, quarter two, we're going to pilot the marketing plan. In year one, quarter three, we're going to deploy the marketing plan. So you make sure that you give it a lot of good thought on how you're going to effectuate your goal and the steps that are necessary to do that. And how are you going to show that visually? How are you going to describe that? You don't have to go into big detail. It would be very boring, quite frankly, as a judge, to sit and listen to minutia on exactly how you're going to do stuff. But if you came up with a graphic, a timeline, and showed for 7 seconds, we have thought this through and we have developed this timeline, then the judges might ask you questions about that later. But it shows that you really thought it through. So speaking of goals, what is your goal? Well, there are short-term goals, there are kind of like medium-term goals, and there are long-term goals. So let's say that you were doing a project on vaccination. You wanted to, the problem had something to do with low vaccine rates. So your short-term goal might be to increase vaccine uptake. And then you describe how you're going to do that. Your midterm goal might be to lower the infection rate. And you could show projections. If we can vaccinate X number of people, it will have this impact on vaccination rates and this impact on this sort of economic impact, right? Because you have fewer people going to hospitals, you have less distribution of scarce resources, et cetera. And then state a long-term goal. Our long-term goal is to eradicate the disease. That's just an example. If you wanted to show a short-term, a midterm, and a long-term goal, how you could do that. If there's any sort of way for you to talk to someone who has actually had lived experience in that sector, talk to them and use their story. So again, with my vaccine example, if I could talk to somebody who had been in a point of distribution, a pod, vaccinating people, and I asked them what their experience was like. And I interviewed them informally, but I could incorporate that in my presentation. Hey, we spoke to people in this space, and this is what they're telling us. And this is why we came up with a strategy to address it. That can be very impactful. And finally, one of the most difficult things I think about competing in a case competition is answering questions. People throw all sorts of questions. Some are very typical and some are out of left field, and you don't know where they came up with that sort of question. Practice answering questions. I would advise you to come up with 15 or so questions that you think they're going to answer, and come up with not canned responses. You don't want to look like some sort of robot. You want to look like you gave it some thought, of course, but practice answering the questions, especially those that are difficult. Come up with 15 questions that you think are going to be really hard to answer and practice answering them. With respect to who should be answering them, well, obviously, the team member with the most information, the most knowledge about that question is the logical person to answer. But that doesn't preclude the other teammates from jumping in. So if Dr. Salter started answering a question because she knows everything there is to know about global health, but I know something else that she neglected to answer, once she has finished answering the question, it is perfectly appropriate for me to say, and may I add, blah, 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 blah. Or, oh, and I also would like to tell you, blah, 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 blah. If possible, have every team member answer at least one question that is thrown out there. Judges don't like it when just one person is the talking head of the team. You are a team. You all have something very valuable to contribute. So don't hesitate to speak up. And that's all I have. Again, have fun and good luck. I mean, this should be a really, really fun experience for you. And hopefully this is just the start of you wanting to engage in future case competitions. Here's my information. My name and my email is just Evian Ostern, the first letter of my last name, my first letter of my first name and my last name at temple.edu, but I'm very easy to find if you can't remember my email. Are there any questions? Let's see. Have you found it to be important to explain how you plan to acquire the funds described within the budget in the appendix? Yes, definitely. So I don't know if this prompt actually gives you a budget. Some case competitions say, okay, you have $2 million to come up with a solution to solve this problem. Others, it's not limited. So you have to come up with how much you think it's going to cost to implement your project. And your appendix will be the supplementary information on how you got to that number. Again, that number should be realistic. You know, it shouldn't be $10 gazillion if you know that that is not going to be affordable for your target population. But again, you're not going to say it's going to cost 10 cents to do this either, because that's not realistic. So try to come up with a realistic budget. If it's too inflated and you can't do your project, take the same idea and scale it down. Maybe you were going to put ads in every single newspaper in the country. Well, you figure out that's going to cost $200,000 and that's above our budget. Then you think, well, we're going to put our ad in the 5 newspapers that are in the most populous cities because it will reach the most people. Or we're going to put the newspaper or an ad in the newspaper in the 5 most rural counties because those folks can't get information via internet. Print is the only way they get their information. So you might have to make some accommodations. And believe me, as long as you can explain why you're doing what you're doing, it's going to fly well with the judges. Can I please type my email into the chat? I will try.
I think that's such great advice to really explain how you came up with something, right? I mean, nothing really throws the judges off more than not understanding how you reach this. Like, they should be able to follow your thinking and your logic and your planning in terms of how much something would cost or money or why you're including things. And I think that's just such great advice to you really want it to make sense to somebody and not to have it not to have your strategy include these sort of leaps of like, well, I'm not sure why they're doing that, but this is what they said they were doing, right? So I think, I think that's just really great, really a really great question to continue asking yourself, your team, as you go through planning your strategy.
And even if a judge disagrees with your conclusion, if you can show, hey, we thought this through, we thought it through from the beginning to the end, that's what's going to impress them.
Yep, exactly. And we had exactly that situation with some of our at least one of our finalist teams last year, where one of the judges said, I really don't think that strategy is necessarily the best way to go, but I see why they picked it. They described how they would do it, and they described how they would pay for it. So, you're not going to deduct anything from them for that. So, yeah, great advice.
Oh, good.
Are there any other questions? I want to give people a chance to, while we have you here, to ask any other questions. I do know that you have to go to another meeting.
I do indeed, but it's really good luck, everybody. I wish you the best of luck. I wish I could watch you all present. And if you have any questions, just let me know. And thank you so much for inviting me again.
Thank you very much for being here with us.
Bye-bye.
And now I can find the clap emoji, which I couldn't find previously because I had too many things open on my screen. Okay, great. Again, I know it's tough doing all of this via Zoom, but it's nice to, it's a good format for moving quickly through these different topics. So I'm glad she was able to be here with us. Okay, so at this point, what I'd like to do is introduce, I'll introduce actually Emily Crisson, who will then introduce the rest of the team. But we want to give you a chance to talk with members of last year's winning team, who then went on to participate and present a new strategy for a new case competition at Emory University. And so for that, I will turn it over to Emily Crisson, who is also the president of the Global Health Student Association and who was a member of the winning team last year. And then Emily, I'll ask you to introduce the rest of the team. And I know you had some things planned before we go into breakout rooms, just so you'll all have a chance to talk with members of the team. Take it away, Emily.
Thank you, Dr. Salter. Yes, hi everyone, I'm Emily. And I will go ahead and introduce my group. Let's see, from last year, we have Ava, Naomi, Vishan, and Sophie, I think is here too. Yep, there she is. And if you guys want to go around and just like say, your major or what you're doing, and then I just have like a couple questions prepared that we can kind of talk with the actual group with, and then we can break out into the breakout rooms with everybody. So Ava, why don't you get us started?
Hi, everyone. I'm Ava. I'm now a senior, but I was a junior when I participated in the competition. I'm a psychology and sociology major with a Spanish minor and a global health certificate. And I am super interested in like public health and just global health in general.
Naomi, do you want to go?
Yeah. Hi, everyone. I'm Naomi. I was also a junior when I participated last year, but I'm now a senior studying political science and earning my global health certificate. And I am also interested in public health, global health, particularly policy, and I'm so sorry for the dog barking in the background, if you can hear that. But yeah, health policy, I think, is really interesting. And I had a great time last year, so I'm excited to see so many people participating.
Okay, Vishan.
Hi, everyone. My name is Vishan. I was a senior last year when I participated, so I've since graduated from Pitt. I'm missing Pittsburgh all the time. And now I'm in medical school. And I hope to incorporate global health, maybe in like global surgery or global medicine or something like that. So.
Amazing. And yes, congratulations. And then Sophie.
Hi, my name is Sophie. I was a junior last year and I'm in the Rehab Sciences program, also interested in doing something with like maybe public health or public policy, which is why this comp was really great for that.
Awesome. Yeah. So thank you guys. And I think everyone can see that we had such a wide range of people on our team. We also had Haley, she's a nursing major, but she couldn't be with us today, unfortunately. So you can see how we really do try and do an interdisciplinary team, and it does work. So it's great that you all will get that experience this year too. So I just have a few general questions that I prepared for us to answer that I think might be helpful, just some advice and, lessons learned, challenges type things that might be good for the entire group to hear. And then we'll go ahead and break out into the small groups. So the first thing is, and I feel like I get this question a lot, and I did last week from a lot of groups. What do you wish you knew at the beginning of the case before starting it? And any one of you guys can go ahead and answer that.
This is a hard question. I feel like it's so hard to say because you learn so much over the whole competition. I think for me, it's that teamwork is so incredibly important with this competition. Like, one person cannot do the whole project by themselves, and you will do so much better if you're working as a team. You're thinking through your ideas as a team. You're challenging each other's ideas. You're being really honest with each other. I think that's something we were really good at was if someone proposed an idea and somebody else saw a flaw in it, we would be very honest and be like, I see, this is why this doesn't work, but here's an alternative. So yeah, for me, it's definitely teamwork. I feel like at the beginning of the Pitt one, we struggled with that a little bit. We definitely pulled it together for the Emory competition, but yeah, I think that was that was it for me.
Adding to that, I think a way to think about it is what we, between the first comp and the international comp, what we did better and differently. And one thing was assigning roles beforehand, not super strict roles, but just general things that one person was good at. So for example, presentation, making graphics, things like that, or finance, budgeting kind of stuff. So maybe that kind of thing.
Yeah, I would add that, it's okay not to know everything about global health. My only experience was with Dr. Salter's class, my only formative experience in global health. But if you just apply your problem solving skills, then you're open to doing research and learning new things and new strategies and working with everyone on your team. As was said before, I think you can formulate a really good proposal for your project. So I think these are skills you learn by doing, I think, and it'd be a really good experience to try to tackle the problem that you guys are facing for this competition.
Right. And just to reiterate, I think just lean on your teammates, play to your strengths. If you're, like Sophie said, if you're really good at writing, do the write-ups. If you're really good at organization, do the budget. If you're really good at graphic design, do the slides. There's lots of very specific skill sets that are really helpful throughout the competition. And you guys should figure out early on who's got strengths in which area and focus your attention on that.
Yeah, absolutely. I think those were all such good answers, definitely better than the answers that I was coming up with. And I just personally, this is so nice to reminisce with you guys. We had such a great time. We had such a great team too. It was so fun. Anyways, back to the questions. Another question that I think is really good and gets a lot of chatter too is what challenges did we face during the competition, and how did we overcome them? I feel like I can think of a couple, but you guys can go ahead.
What challenges didn't we face?
Right.
I can give
a question.
Oh, Naomi, go ahead.
No, go ahead, Sophie.
I was just thinking about something Dr. Van Ostern just talked about, practicing questions. I think that's something that we didn't do and we wish we did. And I think when we got those questions that were so just something we just never even thought about, one person would kind of give somewhat of an answer and give other people time to think, and then the rest of them would like jump in and kind of give like a fuller answer. And so that's in the beginning how we kind of overcame our lack of preparedness for maybe like some of the tougher, more detailed questions. I don't know if you guys agree with that.
That was definitely a strategy we used. I don't know that I would recommend it necessarily. I would recommend preparing for your questions, but it is a good strategy to use when you are like, just when a question comes from left field and you have no idea what to say, someone just starts rambling on and then giving other time to people to think, and then we would somehow get through it. And so I would definitely say prepare for your questions though. That I agree, Sophie. We did not. At least we didn't do that.
Yeah, okay. I guess my advice to you guys is to not do what we did, like prepare your questions.
No, but I think that's good. Like we did do that and it worked, but to do better than us, prepare. Okay, any other challenges?
I don't think we were ill prepared for the questions. I think there were some instances where we would question each other. So like, for example, you might be tempted to, if you feel someone has more experience than you, they might write something down on the slides, and you might be curious like what research article they pull that from, or like how they got that number if it's for the budget. So don't be afraid to sort of question each other and push back. So like, I know I did some work on the budget and people would ask me like, oh, how do you come up with that number? Or how do you get that piece of information? Like, where do you see that? So it's always good to have people, double checking each other for sure. And that'll help foster that teamwork and communication.
Yeah, for sure.
I feel like something. Oh, sorry, Naomi.
No. Go ahead. You're good.
For me, the biggest thing that like I struggled with, and I think we all struggled with as a team, was the budget. For the first competition, we were like, how are we supposed to know like how much a nurse-run pop-up clinic in Liberia would cost? Like, how are you supposed to know that? It was so frustrating. And I think having that like practice with the pit competition definitely helped with the second one. And we were lucky we didn't have to figure out how we were going to get the money. They just told us that we didn't have to worry about that. So that was nice. But I think like for the budget, just doing a ton of research on like how much things cost in that country and just being able to justify your answer. So if you're like, we're going to spend this much money on this thing, and they're like, why did you put that number? Just being able to be like, oh, we thought because of like how much it would cost to pay the workers, or like how much the supplies would cost. We just estimated with like our knowledge and maybe like how much things cost in that country, like that this would be the number. So I feel like that was definitely something we had a really hard time with. But also I think we made an item level budget, which was also very helpful, because then we could like total up the numbers and have like a more extensive budget, which was good. But
yeah, adding to that, they mentioned that like you don't have to put like all the details on like your main presentation, but having like an appendix is really helpful. And I think in both competitions, especially like the second one, having an appendix to reference when answering questions was really, really helpful.
Yeah, I think more generally, sort of coming off the topic of budgets a little bit and focusing on the competition as a whole, I think, and especially in the Ncbi competition, but there was sort of an intimidation factor, right? If this maybe is your first time doing it, or if you're concerned that maybe the people you're competing against are more experienced than you, it can be hard to sort of get yourself off that, off of that way of thinking and just sort of dig in and start and come up with your first idea and just go with it. And if you've got to change it, you got to change it. But like, you can do this, even if you're not experienced, you can absolutely do it. And the most important thing is that you don't want to let that intimidation take you away from like the main goal of your intervention. So like you have to come up with a reason why you're doing this and what is the most important thing within the case and how you're going to deal with that, and keep that as your number one priority. And all of your interventions, all of the things that you put in place to solve this problem should be geared towards that number one priority. Yeah, and don't let the task intimidate you. You can do it. You have a team. You guys are awesome.
Yeah, I think you all brought up so many great points, a few of which I want to highlight. Ava, thank you for bringing up budgets, because that was one of my other questions that I was going to ask like in a minute. So I'm glad we touched on that. Budgets are really scary, but you just have to like jump in. And like Naomi said, I want to bring up that too, is that it is very scary. Like, I'm sure all of you were looking at that 15-page paper and were like just overwhelmed. I know it was overwhelming for myself and the rest of my teammates. But you can do it, and you have teammates to support you. It's not on you. You have people, and that's why it's an interdisciplinary team, because everyone brings something else to their table and everyone has their own talents. So I just want to highlight those 2 points, because I think those are really important. And you have people to lean on. You're not just doing this by yourself. There are so many resources and support, and all of us are here for you too. Myself, Dr. Salter, Bethany, Elaine, like, we're all here for you to help. And even my teammates too. I'm sure they wouldn't mind for me to give them their information. But I'm just speaking for you all now, but I think that those are all really great points. So thank you guys for bringing that up. And I just want to clarify, I don't know if we said this earlier, but we went to the Emory case competition too. So that's why we keep saying 2 case competitions. I don't know if we talked about that earlier, but we won the Pitt one, and then we went on to go to Emory. So that's why people keep saying 2 of them. I feel like we might have time for like 1 or 2 more questions. So I think another thing that's really important is, how did we manage our time and prioritize our goals?
Okay, so the Pitt competition is a month long, and this was something.
Yeah, let's talk about the Pitt competition, because they're not in everyone.
Yeah, so this is actually something we did poorly. I think for the first 2.5 weeks really didn't do much. We divided up the work, and we were like, each person is going to do this research. And then we had a really hard time meeting, because we were all in school. Like, we were all so busy. And then the last week we like got on Zoom, and we were like, oh no, like, we don't have a plan. We don't have a presentation. We have nothing. And we scrambled. It was so stressful that last week, because we were just like, we had no case, and we had to do the entire project in a week. And so I think it's so important to start early and like, I think the most important thing, I think the mistake we did was we like started researching first, which I think is important. But while you're researching, you should be brainstorming ideas. I think that's the most important thing that you should be doing, because that's like the core of your presentation is your intervention and your idea. And so you should be doing that from like day 1, starting to brainstorm ideas. Like, how does my previous knowledge, like, what can I use to solve this problem? Like, they don't have to be good ideas, just anything. And then you can do the research to build onto those ideas. But like, we did the research first. We didn't have an idea. We were like, what are we going to do? So I definitely think dedicating a certain amount of time per week and setting up meeting times where your whole team can be there are so important, because like, it's a team project. You can't do things individually and then come together. You're going to have to build up the idea as a team. So like, finding time to meet and starting early are so important.
I'd like to just real quick make a comment before whoever wants to jump in. The Elizabeth Van Nostren's presentation today was not the first presentation last year. It was like the final presentation last year, right before the case, right before we were supposed to present our case. So that's why we kicked our butts into gear basically and said we need to, do something. So that's why this year we decided to put it first for your first presentation. So I feel like you won't have that same problem, but I don't want to scare you. Like, you're not going to be scrambling. I think it's great that you had this presentation today. I hope that it was really helpful for you guys. I think the information was great. So I just want to emphasize that we were in a different position too last year. But yes, Ava.
Can I just ask, So are people competing allowed to meet with faculty at any point to go over what they've got or like ask questions as independent teams? Like, are they allowed to do that or no?
Dr. Salt?
We have the work session set up, and yes, they can. They do it's hard for people to get together with the people, the experts.
Mhm.
That's why we encourage them to do it during the session. Like next week, we'll have 2 people presenting, and then we'll have this time afterwards when groups can ask questions and talk with them. But yeah, they can certainly reach out in between. It's just we can't necessarily guarantee how much time the faculty member will have to respond, right? What detail they can respond. Your best bet is to get them during these sessions, like when you actually have them here and they're focused on this versus waiting for an email. But you're certainly welcome to do it. Yes.
Right. So then what I would say is, and just speaking from our experience with the Emory competition, and that's just because we were able to meet with faculty members and have them like go over our work. I think that actually really helps, right? Because before you meet with a faculty member, you want to have something to show them. So what I would say is maybe a good way to manage some of your workload is to set goals so that by each work session or by the work session that's with the faculty member you would most like to speak to, you have something to show them. And that will actually just help you to have actual like deliverables that are meaningful to your end project. So you can sort of space it out like that, right? You want to have something to give them so you'll get something done.
Does anyone else have anything they want to add? I know that it's time to go into breakout rooms, but any final thoughts before, you guys will be able to talk to everybody in the breakout rooms too, but any final thoughts for the group? Words of wisdom?
Yeah, I'd say that often, like sometimes it's easy to overthink these solutions and think that you have to come up with some elaborate plan to solve whatever crisis you're facing. But I think often the best public health solutions are the simple ones, and then just expand from there. And then my last piece of advice is, I think Dr. Van Nostrand probably talked about this, but don't discount like stylistic features of the PowerPoint, the way you talk in the presentation. Those things are all important because you're pitching a plan and you want these advisors to the country or whoever the judges are supposed to represent to choose you. So obviously you want to be very professional. And that's something that was really challenging for me because I'm used to like science presentations where you just put like a bunch of text on the slides. And but thankfully, I had my group mates to help me with that and help with that aspect. So
yeah, that's a really important point. Sorry, was someone else saying something?
I'd just also add, like, stay in touch with the people that you're competing with, the people on your team. Connections that you make, like the connections I've made through the global health case competition are like really meaningful, and these people could eventually help you later down the line or throughout your college career. So just like make friends and have fun and like stay in touch with people.
I think the biggest thing for me that I think really helped us was that we really thought through every single, I don't know if we never mind. Well, we really thought through every single thing that we needed to think through. We were so thorough. Like, how many freezers would we need? Like things like that like we didn't need to incorporate into our presentation because we didn't have time. We only had 10 minutes to present it. So just thinking through every possible little problem in your presentation and how you're going to solve it is so important. Like not criticizing, but trying to find weaknesses in your project and then how you're going to solve them are so important. Even if you're not going to present on those very specific things in your presentation, it'll help you be more confident in your solution. And it'll just make your presentation a lot better. And then that way you're also prepared for when you're getting asked questions, you can be like, oh yeah, we thought about this when we were thinking through our presentation. So I think just thinking through every little detail is important, even if you don't have time to include it in your presentation. And finding weaknesses is like so important.
Yeah, I mean, you guys brought up so many great points. I hope people are taking notes because that was great. Yeah, I think it is really important. I forget who said it, Vishan or Naomi, I forget. Simplicity super important, and like feasibility super important, but also like Ava said, being very thorough and thinking through everything. You don't have to make your solution complex. It doesn't have to be like this outlandish idea, but it needs to be thoroughly thought through. And it's not going to be an elaborate thing. I think our one solution was like a phone call campaign. Like that's not crazy or anything, but like Ava said, we thought through like how many freezers are we having? How many people are we calling? That sort of thing. So yeah, great points, everybody. This was so fun to talk through our experience again. I hope everyone learned a lot. So everyone's here. So one thing I did want to bring up that my team asked about was the budget. And I was looking through the case. It looks like the World Bank is giving us money and we have an infinite budget. There's no constraints on that.
We were just discussing that as well, that we didn't set a number. And actually, Emily, let's talk after this session. And if we decide to impose a specific budget, we'll announce that next week. How about that?
Okay.
Sounds like a plan. Discuss like the wisdom of going either way, and then we'll let the teams know next week.
Okay. Sure. So TBD on the budget. We will figure that out and let everyone know. I'll go ahead and ask my group members, was there anything that came up in your breakout rooms that you think is really important to share with the rest of us?
Yeah, actually for me. And I sort of got a little cut off as I was talking about that question with them. But someone asked, like, how do you fit it all into 10 minutes? Like, it seems really difficult. And, taking the advice that Ava said and focusing on all of the details, like, how do you fit all of those details into 10 minutes? And I would say that the answer is that you don't fit all of the details into 10 minutes, where the over preparing for these like little details about things, where that comes in handy is in your appendix slides and for potential questions that come up from the judges. So yeah, when you're doing your very short 10-minute presentation, the bulk of it is going to have to be spent on like exactly what your interventions are and how they're going to work, and why is this going to be feasible in a place like Guyana, given the culture and other circumstances. But yeah, so like, yes, focus on the minute details, but that's not all going to go into your 10 minutes of presenting. It's going to be, making sure you're prepared for questions and, making it clear that you've understood your interventions and the prompt.
Yeah, that's a great point. I think it's super important to have like your team members to have a clear vision of what you're trying to do and all being on the same page, so that it might not exactly come up in the presentation, but it'll help everyone being on that same page. And in the future with those questions and with that appendix, just so that you all know what your vision is. And that way you can, be more comprehensive and cohesive as a team. The other thing I want to say at that point, Naomi, too, is I think I always get this question is how much background information you want to give in your presentation. And the answer is not a lot, right? Because you only have 10 minutes. I think that like I would advise, you can go over the problem really quickly, give people an idea, but the real thing is we all know that there's a problem, and that's why we have this case. We wouldn't be trying to find a solution if there was no problem, right? So you'll show that you understand the complexity of the problem and what's going on through your solutions throughout your presentation. So I wouldn't focus too much on the problem statement as I would how you're fixing it. And then your understanding and comprehension of the problem will show through during your presentation of your solution, if that makes sense.
Two
Does anyone-
questions. We had one was what like we should kind of do first. And I didn't have like a super strong suggestion for this, but I guess like researching the country itself and just like general information, like right before you guys all meet, the first meeting, like virtually or whatever, to like brainstorm those like ideas that you want to get more research for is kind of helpful. So you guys know like what people do, what people need, how much it costs, and then that's like information everyone in your group should know. And then again, having that first meeting to like actually brainstorm ideas, like what you want to do, not just like research and stuff like that. And then another thing someone asked me about was like the way we were organized, like communication, what we used. We all had iPhones, so we used just like texting, and then we had a Google folder that we all used, and we used Google Slides, which is easier because then everyone has access to what like the recent version.
Yeah, those are great questions and answers. I think having the Google Slides in a Google folder was really helpful because obviously we all know how that works. You can see real time the changes and everything. So yeah, definitely second that. And I also, that question came up about how do you start? And I also said the same thing, Sophie, with background information and really getting a good understanding of what's happening in the country right now. I don't know if anyone else would agree or disagree, or if you have any other things you want to bring up from your groups.
Yeah, I was just to add to that, like when you're thinking of your solution, like your main idea, something that's super helpful is looking at what other countries are doing, how like other countries maybe in the same continent, or even countries that have like nothing to do with the country you're looking at, how are they working to solve this problem? Because that could like spark an idea. Like, yeah, it could just like give you an idea on how you want to create your solution. And then also backing up your solution with research. Like I remember for the Emory competition, the reason we chose our solution was because we had found an article that said that was the most effective way to decrease vaccine hesitancy. But we said that we were like, we chose the solution because there's proven research that shows that this is the best way to do this. And I think that really strengthens your presentation.
Yeah. I agree with that. And also there was like even the smaller parts of our solution, we had like some real world like synthesis. So this is kind of silly, but like we had a twist, and our solution to like social media backlash was like hijack the hashtag. And we like mentioned that K-pop fans have done this for like Blue Lives Matter in the past, and it worked. So kind of just like anything you find, like that synthesis connection, like, look, this happened in the real world and we're applying it to like our project, makes it seem like your solutions are realistic and like credible.
Well, yeah, one question I had trouble answering a little bit, but I still took a shot at it, was how we addressed conflict as a group last year. And like if two people had different ideas, how would we go about that? Obviously, everyone in here is pretty passionate about global health, and they're doing this extracurricular because they find it really interesting. So definitely don't discount anyone else's ideas, and maybe try to work together as a group to try to incorporate both ideas into the presentation if they fit. But sometimes you might just have to vote on it or something like that. And there's no hard feelings. We definitely called each other out. I would say, like, you're not going to get. We're all really nice people, but the judges are going to be way meaner than any of you could possibly be to each other. So just don't be afraid to call each other out. Vote on things. It's the hard reality of maybe working in for a nonprofit or for a business. Is some of your solutions won't be good ones, and don't be afraid to say that in a nice way.
But what a great question. Sorry, that's a good question. Go ahead, Ava.
I was just gonna say, but also don't not like give an idea because you think it's bad. Like I remember last time I like said like, oh, like what if we did this, haha, and then we ended up like putting it in our presentation because it was like a good idea. So like even just like if you have even the smallest idea, I would voice it to your group because somebody might be able to like build on it. And like no idea is a bad idea when you're brainstorming.
This is literally what like got us off the ground in our Emory competition. We were all completely stumped as to how we were going to do this. And Ava, like all of a sudden was like, what if we did an app? And like everyone was sort of like, oh, haha. And then the more we thought about it, we're like, wait, we can build on this. So no idea is too out of left field. I'm sure there's research on it you can find, and you can end up building your entire case around it.
Absolutely. I think, working amongst yourselves and your teams, I think it can be hard at first to establish those relationships and feel comfortable enough sharing ideas and thoughts and opinions. And I think we definitely did do some like votes. We had like a Google form or something and did some voting and that sort of thing. But it make your group a safe space. You're all working towards the same solution. You're all working towards the same thing. So don't be afraid to, have a not so, but kind of heated debate, or, get excited about some ideas, build off things. If you have disagreements, that just means that you guys have so many good ideas. So I think that's all great advice. Anything else, or do we kind of want to wrap up? I just want to thank my team for coming. I don't know about everyone else, but I think that this was so helpful, and I really appreciate you all taking your time out to be here with us today, because I think that you all had such great words of wisdom and information and advice to share with everybody. So thank you.
Absolutely.
That's what I was going to say. Absolutely. I just want to second, third, fourth that. I really appreciate all that you've had to share. And I just also want to say, as a teacher, right, the product that you come up with, your presentation, obviously very important, but process, right? You're going through this team process, and right, it's respectful interaction with people you disagree with, and respectful ways to try to steer an idea a certain way, and how to compromise. All those sorts of things are so much part of the process. So it was really great to hear all of the ways, the creative ways that the team managed to work through those challenges, right? Because it's not always just a walk in the park, and it's a lot of work. And so, I think someone had said you do get really passionate about it. And I love, Emily, what you said about creating a safe space, right? You're coming together. You may not know each other at all, but you know that you're students who want to learn more about this topic, more about this process. And you come at it with an openness and a respectful approach that, I'm probably going to not do or have to do everything. And I'll have to compromise as well. And I think it's just, there's so much wonderful potential for that synergy. So it's great to see that this team was able to create that. And thank you for sharing it with this year's competitors as well. Elaine, did you want to add any? I think we can wrap up.
I just really quick want to echo something that Bethany wrote in the chat real quick, because her microphone isn't working, but just to remember everyone that the upcoming Friday lectures will help you with the background information. I think background information is next week. And then the following week is emergency medicine. And then after that is health policy and equity. So these will all really help you also in your background information and building your case. So just wanted to highlight that.
Yes, absolutely. Thank you, Emily, for that. And thank you, Bethany, for sharing that. And one last thing that this reminded me of, because there was a question of how much background. Keep in mind, if you look at your case on page where it tells you your task on page 6, you are presenting to the Guyanese Ministry of Health. Right. So you don't need to describe the Guyanese culture to the Guyanese Ministry of Health, right? You need to know it and be aware of it when you prepare your solutions, but you don't have to present a lot of that information because because of the audience. So I thought of that when we were talking about that earlier, and I did just want to clarify that. Okay. Thank you all so much. Other closing points? Go ahead.
Can I ask one question?
Oh, yeah.
Someone messaged me and asked if we are limited to speaking just with the experts, or can we consult other professors?
Oh, yeah. Absolutely.
Please.
Yeah, absolutely.
You have a whole university there.
Yeah, absolutely. Absolutely. Especially those of you who are in fields outside health, right? Because you're bringing that expertise to the table. And we don't have a lot of faculty from outside health involved in this presentation. We have people from the law school, and that's really it. So please, absolutely. Absolutely. Okay. Well, with that, we do want to speak with one team. Am I remembering that
Number
right?
4.
Yeah, team number 4. If you could hang on the call after everybody else signs off. Otherwise, I think we're all finished up. And thank you all for being here. And please, we look forward to seeing you next week.
If you have any questions, let us know.